Hey, everybody. I am JJ Elliott Hill.
And I'm Natalie Elliott Handy, and we are the sisters from Confessions of a Reluctant Caregiver, and we are thrilled to have you with us today.
We are here tonight as our sixth and final session of the impact of dental health on preventing future medical complications. And this series has been sponsored by Coral and Phillips. So we would really like to thank them. Tonight we have not one, not two, but three presenters. So we're really going to get rolling. We'll probably be talking really fast so we can get them on. First of all, we have Cindy and Christina Hardin-Weiss. Cindy is a physical therapist. Christina is a speech therapist. Their backgrounds in home health care and skilled nursing facilities is extensive. But what we love about them, we love a lot of things about you guys. They founded AE Corner in 2015 because they saw too many individuals struggling with just struggling every day to care for themselves. So they are making life easier for a lot of people. They have a YouTube channel too, so we'll talk about that later. So next we have Jill Meyer-Lippert, and she has over 30 years. You don't look like that old, Jill. She has over 30 years in the dentistry career. She is the founder of Side Effect Support LLC, and that's an online resource center for cancer patients, family caregivers, and healthcare providers. Our goal for Jill is to improve the quality of life, and we love that. We are so glad to have you guys here.
Absolutely.
Thank you.
And so, again, I'm going to echo JJ's statement. I also want to make sure that we talk about our session sponsor. I want to thank Waterpick. They are supporting these ladies, and we've been talking about various folks throughout the series. So make sure you jump in on all of those. And if you missed any of them, but there's a couple of housekeeping things. Last time I'll do housekeeping. Make sure that you use the chat for all your questions. It's the easiest way for us to see it. But when you go to the to button, you'll see either host and panelist, or you will see everyone. So switch it to everyone because it's automatically set to host, because we love for you guys to see each other's questions. And so it may spur some additional questions. Don't forget, we have continuing education credits that we're giving out for speech and language. We also have RNs, social workers, and of course our dental professionals. JJ will put in that link to be able to go and pick up those CEs, and they will be good for up to 30 days after we are done with the series. So that's really important. And then tomorrow you guys will get a survey, the email after, for those who were unable to attend. We missed you. As well as a general survey about how everything's gone. And then we will send out not even as much as a certificate, but an email confirming participation in the series. So for those of you, a couple of folks have asked us about a certificate, just due to the sheer volume of people that we've had who signed up. We're just going to do an email confirming participation, and then folks can let me know through info@sisterhoodofcare if there's an issue. Okay. All right. And so without further ado, ladies, I am so excited. We're going to start with Jill tonight. And so, Jill, I want to start off with some questions, and this is going to be a very conversational. So let's kick off with any things to consider when choosing. Let's talk toothpaste, because this is going to be all resources for tonight. Resources and how to do some things. And I have all my stuff too. I'm very excited. But let's talk about toothpaste and choosing a toothpaste for people who have special needs. What are the things that we should consider?
So one of the things that I would consider is looking at the ingredients. Obviously, number one, there is a very common ingredient in toothpaste and a lot of oral care products called sodium lauryl sulfate. And that is a detergent that helps to give toothpaste that nice, thick, foamy consistency. And unfortunately, for some people, it is actually a skin irritant. So if you have anybody that has any tissue irritation, is prone to mouth sores, burning mouth syndrome, or somebody that just can't tolerate that foaming, that would be a great thing to exclude from your toothpaste. Also looking at flavors for people that have dry mouth issues, that have tenderness in the tissue. Sometimes flavors can really be a hindrance for them, even nausea problems. So there are a number of toothpaste out in the market that are very mild flavored. Some are unflavored now, and there are some that with children's flavors can be much more agreeable for some people.
That's interesting. I do love toothpaste. Jay.
Well, now you went straight to toothpaste. So,
I know,
but
right?
is there information that we need maybe on the toothbrush, Jill? Is that?
Yes.
Well, tell me
What's
about
the-
my toothbrush. I know she had that up there and thinks, hey, I want to make sure I don't forget that. So tell me about a
Yes.
toothbrush.
So I do have some examples here.
Great.
This is one thing that I find to be very challenging many times for people. When you go into a big box store or your pharmacy, a lot of times the toothbrushes are very large. They're very large and they have stiff bristles or medium bristles. And back, I remember when I was little, my dentist telling me, get a stiff brush and really just scrub hard. And that's like the worst thing you can do. We've learned a lot through dentistry. You don't need to be so rough with cleaning. You want to have a nice soft bristle brush, but you're going to have a lot better success at cleaning if you use a smaller head toothbrush. So this is an example of, you can see the difference in the size, but there's so many that are much smaller. And for some people, even using a child size is a really good idea, and using those softer bristles. A few of the areas that are so often missed when brushing is along the gum line of the top molars and going to the back side of the top molars, and then along the tongue side of the bottom molars. And often that is because people are using too big of a brush. So I'll just show you a little trick. If you're trying to get around the cheek sides of those top molars and to the back side, if you open really wide, your jawbone will actually move forward and you will hit that jawbone before you get to the back tooth. So you'll feel like you're getting to the back, but you're actually just hitting the jawbone and it's blocking you. So whatever side you're trying to reach, the trick is close about halfway and then shift your bottom jaw over to the side that you're trying to reach. And that's going to actually take your jawbone back and to the side that you should be able to sweep all the way around that back side of that last molar. So that's a really good tip.
It is. Wow,
There are
that's good.
so many specialty brushes
all
out
going-
there that they're tiny. They've got great little bends in them.
Look at those ones.
And
thanks.
they really help to
Look at
reach
that
around
kitty.
areas.
Yeah.
So you don't want to, some people think I'm going to have a really big brush because I'm going to get more surface area in the strokes, but you end up missing more. You're going to get a lot better success by using a smaller brush and using small little strokes in those hard to reach areas.
Do you think that it's with the bigger brush? Because honestly, I mean, sometimes we're impatient, right?
Yes.
We're like, really, I'm impatient. I'm like, get this biscuit done. And so if I've got a bigger brush, I'm thinking I've covered more area. And so I really have a big mouth. I like to say that Jason laughs at me, but I'm all like, I could probably get my hand on back in there. And so, but do you think it's because the head is bigger and so people take that for granted? So they're like, oh, I've really gotten in there and then I don't need to make those adjustments. Whereas a smaller brush, because that's what I would have thought. If I've got a small brush, I might be spending 20 minutes on that bad boy. So yeah. And if you think about the electric toothbrushes, they're like a small head.
Little round things sometimes.
Little
Yeah.
All of them are. And actually what you're looking for, an electric toothbrush, those are the same things you want to look for is softer bristles, a smaller head. It's going to be easier to reach in areas, and you're going to be much less likely to cause toothbrush trauma. And especially whether you're brushing yourself or if you're helping to brush a loved one's teeth. You're going to be, it's harder to tell if you're going to be causing toothbrush trauma. It's going to be much less likely if you're having a softer, small brush.
Toothbrush trauma. I know.
I like that. I like that word actually.
Yeah,
I had
yeah,
never
yeah.
heard of toothbrush
I
trauma.
love the
but that-
alliteration, toothbrush trauma.
Yeah.
Real quick question. Jennifer had a really good one because I'm going to jump in as we see them. Who makes an unflavored toothpaste?
So there are some, very mild flavors, but there's an unflavored, there's a brand that I like called Squiggle. That is one that has an unflavored paste. There's a closest paste that is very, very mild flavored, also sodium lauryl sulfate free. So that's really helpful for not having that foaming. And it's just like for any of these, even with the specialty brushes, the flavors of the toothpaste, it just takes a little research on finding them. And I think that's one of the biggest things I want people to come away with when we talk about all these tools, product suggestions, is to just not give up. There's so many things out there that it sometimes just takes a little research, and then also just asking your dental provider, asking, looking online for trusted resources that can point you in the right directions, because there are so many options out there.
So this is interesting because Margaret's asking, do you still need to use strokes with an electric toothbrush?
Actually, what you can normally do with that is just hold it in different areas, and it really does the work for you. So sometimes with dexterity issues, that is a real bonus for people.
Mm. And one other question related to that. So I bought an electric toothbrush, and it has an app, and it tells me if I'm doing it long enough. And honestly, it's like 2.5 minutes is what it's telling me, because it's like, look, girl, you're impatient. And so I try to use that to do that. Does it still work the same? Or if you're aware, if you don't know, it's okay. But if I were to brush our mom's teeth, or if I needed to brush Jason's teeth for some reason, does the app still work? Because I'm wondering because the app shows me when I'm good for an area. Does it work that way, or do you have to do special things with the app by chance?
Well, I know they do have the smart toothbrushes that can track that you are. So I'm not sure are you talking about like if you're sharing a
No, I think you have your own. I think my question
Okay.
was really more of like, if it's a setting, I'm right-handed, it can tell where I'm going.
Okay.
Whereas as
gotcha.
opposed to I'm brushing someone else's teeth, and the app, is it picking it up right, if that makes sense?
That's a great question. I don't know for sure, but I think that I believe that it would pick that up as well.
Okay.
You would think, to some degree, it would pick it up, wouldn't you?
Yeah.
Yeah.
Well, I think we'd probably end up figuring it out even if it's opposite,
Right.
we're gonna get around it.
Mhm.
Okay, that's really cool. Okay, sorry, Jay, my line of questioning is done at this moment.
Oh, I know. I'm like, okay. So I know, because I'm going to pop back and forth because we just looked at toothbrushes, but I know when we were on, first of all, so what if I have trouble holding a toothbrush? Cindy, Christina, because I know we have a lot of people who aren't brushing their own teeth, or they have difficulty.
Right.
With you guys are with AE Corner, so you do a lot of adaptive equipment to make life easier for both me and as a caregiver, and also as someone that, may have some dexterity issues. So show me a trick. Jill's shown us all these beautiful toothbrushes.
Yeah.
What's something that I could use if I wanted to brush my teeth, but need a little help?
Right. Yeah. So, the big thing we want to make sure is that, if the person can still brush their teeth or use any kind of dental implements to any degree. We always want to promote functional independence because it promotes dignity. So having said that,
yes. So, if somebody's having some trouble with grip, whether if they're having some dexterity problems, if they're having some weakness, whatever is going on, the big things that we look at is you want to try to increase the surface area if it's a gripping problem. You want to try to lengthen. We'll show you this. Lengthen the lever arm if you are having difficulty, reaching, range of motion, things like that. And you also want to add some grip to it. So, for example, this toothbrush here, we just built up the handle. This is just
pipe insulation.
Yeah, pipe insulation, got it from Ace Hardware. And then this is self-adhesive elastic band. So it's this type of stuff you can find, in a big box store. Yeah. And then we just wrapped it around there. And again, we're just increasing the surface area so that we're not having to grip so small and grip so tight. So that's something that
It's
you
a
can
nice
do.
little life hack.
Little life hack, a toothbrush, but it can work from just about anything.
Here's another little life hack that we use. It's taking a tennis ball, cutting a slit in it, and then you could put the toothbrush in there. And now you've got a really more of a resting hand surface that you can actually use to brush your teeth. So these are more like the life hacks. And then of course we've got some things that are more commercial. Like for example, this is called an Easy Hold. It's a silicone strap. It's food grade silicone. We put it on the toothbrush. If you have difficulty with your grip strength or pain in your grip, you put this across your hand like this, and you don't even have to have a grip at all to be able to maintain your functional independence when you're providing oral care for yourself. So something along those lines. We've also got a thing called the functional hand. So this is maybe if somebody has range of motion issues in their wrist, you would put it in here. I've got a long handled dental floss.
Yeah.
If you can see that. Yeah.
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 I'm like, where's the camera?
Yeah, we got you. You're on there.
Okay, so now you got this almost at a right angle, right? So you either as a caregiver or as the individual, if you have wrist mobility issues, you can get back there. Then you could flip it around and you could do the flossing on your lower teeth as well. But this has got a nice built-up handle. You could fit just about anything, your toothbrush in here, or the dental floss. Because we thought with the dental floss, if you have pincher issues, difficulty with that, you probably need to get something with a handle so that you're able to move that down into the palm of your hand instead of your individual finger. So,
So
Yeah.
Okay, that's
Jill,
really
all of
cool.
those,
Go ahead.
all that would work. So basically we're getting our teeth clean. So that kind of bumps us over. Okay, that'll work.
Correct,
So
yes.
what else? What else have you got today? I know that we were talking about contamination.
Yeah, that's what I was thinking, jumping back to Jill about contamination of germs on your toothbrushes.
Yes. So this is something that with side effect support, my target audience typically is the cancer patient who has, a very compromised immune system. So I'm always very conscious about cross-contamination with toothbrushes. So if you go into most people's bathrooms, typically you'll see that you walk in and see on the counter in a cup, everybody's toothbrushes from the family sitting together, touching each other. And this is a great way that bacteria, viruses, whatever germs are in one person's mouth to transfer to the next person's through that toothbrush contamination. Also exposure to a flushing toilet and other things that are floating around your bathroom, which most people don't like to think about. And truthfully, for most of us, if we have a really hardy immune system, it's probably not that big of a deal. But for people that have other medical compromising conditions, this could be really serious for them with an infection. So sometimes people will say, oh, I like to use those plastic travel covers. Put that cap over the toothbrush and that will, protect it in some way. But unfortunately, that doesn't allow the toothbrush bristles to dry out thoroughly. So it ends up holding that moisture in the brush. And that's a great way that bacteria can build up on the brush. So anybody that's ever used those, when you take that off, you may remember seeing that little white film that builds up in there. That's a bacterial biofilm. That's basically encasing your toothbrush in this nice little greenhouse of bacteria. So there is a device.
I'm thinking about how much makeup I have on my toothbrush at this moment, ladies. I'm not going to lie to you. Putting on my makeup and get a little wild in there. So
So there are shields. There are breathable, disposable mesh shields, fabric mesh shields that help to draw the moisture out of the bristles. So it helps to dry out those bristles, but it's breathable and it helps to prevent cross-contamination. So if everybody's using their own, or if one person's using their, if you have anything touching them, it just helps to protect that against germs. And they can last up to 7 days. You just throw it out, put a new one on. If somebody has an illness, they usually recommend changing it every 3 to 4 days. These are called an Intelligent toothbrush shield.
Okay.
And
Intelligent, INTELLIDENT.
Yes.
Got it.
And this is something that, just as an example, there are some hospital systems. One is Children's Hospital of Wisconsin, uses these for their inpatients as an extra protection for their patients, for protecting against infection. It's something so simple. They're not expensive and really can make a difference for people.
Wow.
Yeah, that's cool.
I really did not think about how gross my potential toothbrush was at this
I
time.
know.
I feel like I need to tell you this, ladies, because I put on my makeup and I know when we're all washing our countertop off,
Yes.
makeup on there. So I don't know why I just magically thought it just didn't get on my toothbrush, which is hanging out right beside me. So that's a little embarrassing, but now I've told the world, so I feel better about it.
I don't think about my hairspray and everything. I'm
you do not have to go to hairspray. Okay, so the Intelligent shield feels like is a must at this point.
Absolutely.
Absolutely.
Awesome. Jay.
So my next question is something I really want. So it's a water pick. So getting in between my teeth. So Natalie has one. Maybe that's why I'm
There it
jealous.
is. Look at that.
But let's
Nice.
talk about, it looks like it's larger at the base, so it may be easier to hold, but tell me about that, Jill, and why that's so important, getting between my teeth.
Well, there are many devices to clean in between your teeth. The most common is going to be your dental floss, which can be very technique sensitive, and it's hard enough for people to floss their own teeth sometimes, but especially if you're a caregiver, to try to floss somebody else's teeth. I've worked 30 years as a dental hygienist. For me, it's second nature, but for most people, that is not an easy thing to do. So besides water picks, I will show you a couple other things. There are different brushes that you can use in between your teeth. I'm going to see if we can, all different sizes, that depending on the space between your teeth, you can actually brush up in between them, but you just need to pick something that's appropriate for the size of the space that's in there. There are also brushes that come in with handles to help reach in between your teeth. But the water pick is something that's much less technique sensitive. There are the countertop models, which like this one is one of my favorites because it's rechargeable and you can just charge it up and it lasts for 4 weeks. And you can fill up the tank and it will get you through the whole mouth. And it has a 30-second pacer, so it'll show you or tell you like when to move on to the next section of your mouth. And there's also the handheld models that this one, which is similar to what Natalie has, this is actually waterproof. So this is something that can be used in the shower, which is a great advantage, especially if you are a caregiver and you're trying to use like a catch basin for somebody that's wheelchair bound or bed bound. In the shower is a really great way that you can kind of get everything at once. And this is also great for somebody with dexterity issues. If you have somebody with Parkinson's, it's going to be easier for them to grasp this versus the smaller handle, the handheld units sometimes. And the neat thing with water pick is that this is a standard universal tip, but there are many other tips that come with them. There's ones for orthodontics. There's this called the plaque seeker tip for implants and restorations. There's what's called a pick pocket for areas that have like deeper pockets underneath the gum line that they want to put a medicament down into those areas. This is actually for an implant supported denture to help get up underneath that denture to clean there. So there's a lot of specialty tips for individual situations to get them the best results.
So
that is cool.
I want to switch over. No, I think the water pick stuff, I didn't realize there were so many different heads. But it makes my mouth, I'm thinking about my mouth being a little dry right now. And and so I want to also talk about some of the things that we can do for dry mouth. And I know that we've got our friends from McQuarrie who have, again, options. But I think Cindy and Christina, I have one with me. Happen to have one right here. It's this little handy dandy thing, but I mean, I do have big hands. I would like to acknowledge that. And so this is kind of small in my hands. So if I'm a person who might have dexterity issues, it might have grip issues, what are some things that we can do to, if I want to use this, but I can't hold it, it's like bigger than my hand. So what can I do?
Good question.
Right. Yeah. So again, we're going back to trying to add something. So again, we have this, I'm just going to tell you, I love this stuff.
We have this in our kitchen drawer,
all
that junk drawer. We always have a roll of it because we'll use it for something.
Use it all the time. But so we're just putting a little bit around the base here to help us with some grip. I actually took a rubber bumper and put it on the spray top. It's just like a cabinet bumper. You stick on your cabinet door so it doesn't slam shut. The top of this doesn't have the ridges on it. So if somebody had some trouble with some slickness here or just needed a smidgen bigger area to push down on, you could add a rubber.
Rubbery, so it's got some texture and some grip to it that you could put on there. You could also, if you were crafty, you could use a hot glue gun and maybe take a tongue depressor
Mhm.
and hot glue it to the top of that. And then you would have like a T where you could actually use 2 or 3 fingers to
Ooh.
squeeze down.
Rather than just the one.
Yep.
Okay, that's a good idea.
Yeah,
Mhm.
I'm
yeah.
thinking about, I'm like, ooh, I wonder if there's some modifications in the sense of
Mhm.
like your recommendations. I'm thinking our friends at A Coral may make some like, hey, if you have some
Yeah.
hand issues and being able to push the little squirty button, because I mean, I just used it actually, and now I'm a little happier. And so I'm thinking, really, like
Yes.
if I have a hard time,
Yes.
Yeah.
Jason has bigger hands than me. He's got big old
Yeah.
man hands, and he gets all over. That tongue depressor makes sense, and
Yes.
so I'm meeting both needs.
Yes.
With
Mhm.
being able to respond to the dry mouth piece using this, and
Yes.
it's gonna
Right.
be, of course, long lasting. So,
Mhm.
okay. I
Absolutely.
love that you all have the little stuff that you put around it for
We use it
this.
on everything.
Yeah.
I mean, everything. It just
We
seems like
do.
the older I get, the texture, my finger
Yeah.
prints are going away and everything's slick and I can't hang on to anything. And so, yeah,
Yeah.
I wrap that around it and boy, I can take off
Mhm.
lids like a champ.
Yeah. That's actually makes a lot of sense. I'm looking over, let's see, Janice has a quick question. Jill, is the water flosser the same as a traditional water pick? She jumped back over into water pick for a sec. Is it the
Mhm.
same?
Sure.
Okay.
Yeah. So Waterpik is the brand.
Mhm.
And so there are other brands that are coming out with water flossers right now, but Waterpik has been around for a really long time. And they've got about 80 clinical studies to back up the safety and efficacy of their products. And many of the other brands they haven't been. So in full disclosure, I am a professional educator for Waterpik in the Northeast Wisconsin area. So I do lunch and learns with offices and feel very passionate about the product. And they've got the time and the research to back their success.
Mm,
Yeah.
mm,
Yeah, it's
okay.
nice to know.
And then
So-
go ahead.
I
Jill.
know that we're kind of, we're like, okay, we've got so much to talk about. Okay, so I'm going to jump over to Christina and Cindy
Yeah. go right ahead.
because we had talked about, both of you all have the therapist backgrounds, speech and physical. But as far as physical limitations go, I know you guys have probably seen a lot of that in your background, in your
Right.
careers,
Practice.
that could limit individuals with good care. I know we've talked about grip. Are there other things that you've seen that maybe limit what their care can be as far with dental care, with oral care?
Yeah, well, what we were talking about, or I showed a little bit earlier, a lot of times people have a lot of shoulder issues. They have severely limited shoulder range of motion. And if you think about it, when you brush your teeth, you're usually bringing your elbow out and bringing your toothbrush across. So what we recommend is if you need to, try to add it on. So we just added one on with our favorite stuff right there to the end of a wooden spoon. And so basically this would allow me to reach my mouth. So I've got my elbow tucked at my side. I don't have to bring it out. I don't have to move my shoulder, but I can do a little dental care here without actually having to move my shoulder. That's a big thing we see a lot of is the shoulder range of motion and the limitations there with aging adults, depending on the population. And so that's kind of another thing we're just increasing. You can use a dowel rod, you can even use a ruler to put something on. So yeah, that's something that we see. And then some of the other limitations may be that they only have use of one hand. So we have this little item here. This is called a toothbrush pillow. Okay, so if you need to lay your toothbrush in here so that you can put toothpaste on it, so you can lay that down on the counter.
This is kind of rubbery and it doesn't scoot. It's non-skid, so it wouldn't skid on.
Okay.
So that'll hold your toothbrush for you while you put the paste on it. If you're able to only use one hand. The other thing is now most lids on toothpaste right now are the flip top lids.
Yeah.
Remember these old ones where we have to screw those off. But of course we have a travel size here. So the hole next to this will allow you to put that in there. One-handed down on the counter and then twist and bring your cap off of your toothpaste.
And then they make a food grade silicone cap. It's a self-sealing cap. So once you get the lid off of the toothpaste, then you just put that on there and that self-seals and then you don't have to keep taking the lid off and on. It's just a little self-sealing cap. Mhm.
When I'm thinking about the use of the wrist there, that I think I
Yes.
could see that. I had a really interesting question. I think this may go back to you, Jill. I like how we're going back and forth. Guys, we're going to stay a little bit longer. So we want you guys to stay.
Yeah.
If anybody has to leave, I just want to make sure that we recognize our friends at Coral and Phillips for being our series sponsors. I mean, I'm going to tell you, I've been using it. I thank you for these folks. We'll have a formal end, but I just want to make sure I recognize Coral, our friends there. Amazing product, and we thank you for that and sponsoring, as well as Phillips, and then this episode sponsor, this session sponsors Waterpik. So I just want to make sure that happens. So Lorraine asked about Sojourns. So does Sojourns affect the enamel on your teeth? I've been having an awful feeling on my teeth lately, like they are not clean.
Yeah, so with Sjogren's or any condition where you have dry mouth, the lack of saliva can be very detrimental to the health of your mouth and the health of your teeth. Your saliva adds a lot of protective elements in it that helps to lubricate the tissue. It helps to balance the pH. It helps to remineralize your teeth. And when you're lacking that, you lack all those protective elements. And that's why it's so important to treat dry mouth. To use products to help to relieve not only the discomfort, and so many times it's treated as just discomfort, but it is so much more than that. And I think that's, going back to the Coral, that's one of the really great things with it is it's unique because it is lipid based and it helps to bind to the oral mucosa, to the tissue, and it helps to, give not only a protective coating on there, but a long lasting result. So this can be used on its own, or it could be used in conjunction with other oral moisturizers to help kind of lock that moisture in. But yes, it definitely
I got a lot
can.
of moisture right now going on in my mouth. I've been spraying. I sprayed a couple of times, and I'm over here happy as a little lamb. I'm trying not to drool. I'm like, it's fantastic. It's working. So,
But that I could say that, if you don't mind, that is one of the reasons, though, too, that anybody with dry mouth really should be seeing their dentist on a regular basis. I mean, more frequently than every 6 months. Sometimes it's every 3 months, every 4 months, depending on that severity, because they can help to put protective fluorides and agents like that to help protect your teeth.
Okay.
I've got another question over here. I don't want me to monopolize, Jay. Feel free to jump in at any time.
I'm reading them as fast as I can.
Yeah, that's okay. What can you do if the person is unable to tolerate toothbrushing? And a question for the entire group. So, Jill, you want to start? And then, ladies, if you've got any other ideas.
Well, my question would be, in what sense? Is it the tenderness of the tissue? Is it gagging? Is it, what is the intolerance? That would be my question.
Cognitive changes is what Margaret said. Due to cognitive changes, they're not able to tolerate it.
It gets tough.
I'm glad that you're being authentic about it.
Yeah.
It's tough.
Go ahead, please. No, go ahead, Jill.
Okay. Part of that may be too is getting something very tiny and being able to sneak, maybe not a good word, but sneak things in there a little bit more gently versus the large head of the toothbrush. There are like the foam toothets, but those really don't clean very well. So it really does take some mechanical motion with the brush to get the best effect.
And depending on their cognitive changes, how severe it is, they might not be recognizing the activity of toothbrushing as something that's going to benefit them. So maybe finding out, is there a different time of day that maybe you could approach them? We don't have to just brush our teeth at the same time every day. So maybe approach them with, the toothbrush again, maybe make it colorful, maybe make it a certain color that they can see where they might recognize it. If you're in the bathroom, make sure if you can try to get them into the bathroom where they might recognize that this is what we do when we're in the bathroom. But it could really just be depending on, their decline in cognition, that they just aren't recognizing the daily activity that you're trying to get them to participate in.
She did bring up a point, and Christin, I know both of you guys, and then Jill as well. When, for example, our mom, she also, these cognitive changes has caused some issues with rinsing and spitting. Any recommendations for that? A toothpaste that won't leave a foam, or any recommendations for someone that physically is having that kind of difficulty.
Sure. I would go back to avoiding those detergents that are going to be
Okay.
foaming.
Okay, good.
There are different toothpaste that are safe to be swallowed. And sometimes it may be using a children's toothpaste or an infant's toothpaste, something that, they do make those that for little ones that cannot spit as well.
Okay. All right.
Margaret's asking about which one, what's the name of it? It says Safe Swallow. What's the name? I think it's honestly,
Oral-B makes one. I know there's several of them. They are in the baby aisle, aren't they, Jill? If you're just going with one of those.
Another one to look at is the brand name Spry. They have xylitol toothpaste, and those are you have to be careful that some people might have some GI issues initially with it because they're digested as a fiber. But if they're introduced slowly into the routine, for most people, it's not an issue.
Also got a comment around brushing with a mouthwash. And somebody had also mentioned on the side in the chat, you could try using a soft face cloth and rub on the teeth. Like, are you thinking add it that way? So instead of the brush and it being more intrusive, because I can see some people feeling like there might be a gagging sensation. If we start to mentally kind of cognitively decline, it could feel very foreign. So any thoughts on any of those or other ideas?
I think with the washcloth, again, if you're not recognizing the toothbrush that you've been using your entire life, I'd be up for trying anything, just for protecting oral care. But they might not really recognize if you're coming at their mouth with a full-size washcloth kind of thing. So,
Gotcha.
Right. And I could see the comment in there that looking to reduce the bacteria in the mouth, that really is the main goal. So whether it's a brush, whether it's using a little gauze that's wrapped around your finger, if they can tolerate that, is just going to be so individual for each person of what's going to be the trick to work for them. And that kind of goes back to that really, being open to trying different things and not giving up.
Okay. This is
I think that's what Mary Kelly said yesterday. If it doesn't work one day, just try again the next day.
That's right.
So just keep trying.
So, question for Cindy and Christina, any other recommendations for accommodations for those with limitations that might make you, it really is to maintain that independence. So any other, like kind of closing us out here, any other recommendations on any additional accommodations besides the really cool sticky stuff? You guys have gotten so many great, like different ideas, but all three of you ladies.
Here's just everybody's got some of those squeezy balls or a squeezy, squeezy thing. We just took a toothette and stuck it. We cut a slit in the squeezy ball and stuck a toothette in there again with the so something. Just think as far as what would be comfortable instead of this. Think this and what would be something along those lines. So I think if you stick with the texture and the surface area and the lever arm and you try to address those three things. I think you're gonna find that you can find something. And again, if you're a DIY, break out that glue gun, girl.
That's right.
And
That's right.
Figure it out. You know what? You can learn anything on YouTube, and I guarantee you there's stuff on YouTube that will show you how to adapt things using a glue gun. And OTs, they always have this kind of modeling clay that you can make like a hand splint almost with, and it sets up to that person's grip. There's all kinds of stuff out there, but man, I would suggest going to YouTube. You could re-roof your house off from YouTube. So,
well, that is facts. I'm not gonna lie to you.
So Jill, I know you guys have, because we're like, we could stay here for hours. So Jill, I know that you both of you guys have great resources online, and I want to make sure that people are able to find you guys. Jill, you are Side Effect Support. Give me your website. I know it'll be in all of our notes and our emails tomorrow, but go ahead and tell us about that.
Yeah, so it's sideeffectsupport.com, and it's a resource that I created for cancer patients, for family caregivers, and healthcare providers to help reduce the oral side effects of treatments. And that's through a lot of free information, access to over-the-counter products, and also through partner companies to help provide services and extended products that I can't necessarily provide myself, but really are great advantages for people.
Okay. And Cindy and Christina?
Yeah, so our website is aecorner.com, A as in Adaptive Equipment Corner, aecorner.com, and then we're also on YouTube under Adaptive Equipment Corner. Ladies, I just had one question. Margaret had said something about aspiration precaution. Now, you guys addressed aspiration issues in another session, didn't you?
Yes, I believe.
Okay, and so everybody will have access to that at some
Yes.
point in time?
Do you-
Okay.
But yeah.
Go ahead. And
But if you want to
go
touch on them again, because
fine.
that is your speech therapist. I mean, both of you guys, if you want to just touch on that person that has the questions about that, the precautions for aspiration, Christina, do you have something that you'd recommend?
Yeah, I mean, it's going to depend if you're talking about somebody that's got cognitive decline or dementia, that's living with dementia, that just the activity of making sure that you don't swallow the toothpaste and that you actually spit it out. And again, with the water, rinsing with the water and spitting it out, it's just going to be a matter of making sure that you spit it out, maybe leaning forward a little bit so that it pulls the water into the front part of the mouth and not so much running that risk of it going to the back part of your mouth. That's what I would probably recommend. But like thickening water, you just probably wouldn't get. I'm not sure that you would get that sensation of a clean oral cavity with thickening liquids and stuff. So, but there'd probably be a whole nother story if you're dealing with somebody with dementia and trying to keep them forward and they have aspiration as well.
All right. Well, ladies, I'm gonna send us to the end. Folks, if you have questions, feel free to keep putting them in there. We will make sure we answer them. Ladies, thank you so much for being here with us. This is so much fun. I wish we had another, 10 hours, honestly, because I think there's so many fun things. And I swear to you guys, you are like the MacGyvers. Like, so the MacGyvers of using the products. I'm sitting here thinking, this is so cool. Like, we can add it here. I do want to make sure that I'm going to take a minute, I'm going to slow down, and I'm going to thank our series sponsors. I am going to thank Coral, my friends at Coral. I really appreciate it. Was because of them and our other folks that were able to do this. And we don't support products we don't believe in. That's my answer. And so I want to thank our friends at Coral. I want to thank our friends at Philips, who was also our series sponsors, who jumped in on this. Our session sponsors, Velscope, Waterpik, and the Oral Cancer Foundation. These folks have been amazing. And then our series partners, the American Academy of Oral Medicine, the National Foundation for Swallowing Disorders, the support for people with oral and head and neck cancer, Thyroid Head and Neck Cancer Foundation, I apologize, Thyroid Cancer Survivors Association, of course, Jill with Side Effect Support, of course, Cindy and Christina with Adaptive Equipment and Caregiving Corner, and of course, Allison Brenninger, our friend with the negative space. And we just appreciate you guys and taking your time. We appreciate all the folks who have stuck with us. We say we went a little bit longer here, but we knew we had 3 amazing presenters. We wanted to stick with that. And of course, you'll get the email tomorrow, and you can still tell your friends about this. The videos are up on our YouTube channel. We'll make sure these ladies have links. Coral has the links as well, so you can hit multiple places to find this series. And Jay, any parting words?
Just thank everyone for coming and thank our fantastic speakers. I'm looking forward to, more information as we go. I know I've learned a lot. So thank you, Jill. Thank you, Cindy and Christina.
And we also mentioned Tom, Dr. Villa, Jill, we have Jill, Joanne, Mary
Kelly.
The guy, because I butcher his last name, and guys, my friend, and he'll let me. So guys, we had so many wonderful presenters. Thank you for being a part of our series. And until the next time when we see you again, thanks everybody.
Bye-bye.
Bye.